Good evening. Welcome to the Access North Texas Public Outreach Meeting. NETCOG was established in 1966 as a voluntary association assisting local governments in the North Central Texas region. We assist with planning for common needs, cooperating for mutual benefit, coordinating for sound regional development. The Transportation Department is federally designated as the Metropolitan Planning Organization and coordinates services and creates short-term and long-term plans. For more information about the Council of Governments, please visit www.nctcog.org. What is Access North Texas? It's a regional public transportation coordination plan. It is required by FTA as well as TxDOT. And the information is actually used for planning and funding decisions. So it is important that we hear feedback from our community and the region as a whole. We want to know your transit needs. If you would like to look at the 2018 update, you can find that at accessnorthtexas.org, and as well as input opportunities for the 2020 update. These are the current existing services in Kaufman County. There's a Star Transit, Dial-A-Ride, and Star Transit, or Star Now, excuse me, DART Vanpool, Texas Kidney Health Care Program, VA North Texas Healthcare System Travel Benefits Program, as well as Veteran Transportation Services. Next, we'll share some of the questions that you will see in the survey. First, in the last 6 months, have you missed any trips due to a lack of transportation? This could be medical trips, recreation trips, whether it's going to movies or getting some dinner or even religious services. Next, what keeps you from getting where you need to go? Here, perhaps there is transit in your area, but is it a situation where perhaps it doesn't run at the times that you need it? Maybe you're a shift worker and you can get to work, but you're unable to get back home because transit is not available at that time. Or does it take you too far the way? Does it take too long to get you to and from your destination? Next question is, which potential services would be most appealing to you or members of your household? Again, this could be a situation where anything would be good, but perhaps one works better than the other. So what would that be for you? Next, what is the best way to enhance your transit experience? Here we can think about our current, our current environment. Is it a situation where you might feel better about transit if the individuals in your particular vehicle or the vehicle you're utilizing, maybe there was less people in that particular bus or van, train, car, maybe again, the transit is in fact there and it's working, but how could that be enhanced for your particular experience? How can transit service be improved in your county? Here we want to know that maybe, again, transit service is available, but what would make it better for you? What would make it just a little bit easier for you? These are the current Kaufman County strategies. There are several that have been put in place, and these would be as a result of the 2018 Access North Texas Plan. So like you, some individuals sat at meetings like this and shared their feedback and perhaps even on their surveys and shared some of this information, which was then later gathered and placed in detail into the actual plan. And these are, we call them strategies. Some interesting ones here is perhaps maybe advocate for agencies to integrate funding sources to maximize efficiency and increase available affordable transportation or public transportation. Another is continue to conduct driver safety and sensitivity training to improve riders' experience. Again, perhaps there was a situation or where maybe a driver, or you felt that a driver can maybe benefit from a little more training, whether maybe the wheelchair did not lock properly, maybe the individual was just not well versed in that particular mechanical technique, and you felt that maybe this could have been a situation that could have been helped with just a little more training. Finally, this is the website where you're actually find the survey. So you'll want to go to www.accessnorthtexas.org and take the survey. I think at this point where our staff have all reviewed it, and I think we're at maybe 7 to 9 minutes of time to get through and make all your do all your responses. This is another tool that we've introduced. It's called Map Your Experience tool. And on this, you're able to actually pinpoint maybe where your starting location is and where you want to go. Perhaps it's Target or Walmart or this particular hospital that you'd like to visit or that you visit frequently, but you're unable to get there due to a lack of transportation. So you will find this in, if you are in the Access North Texas website, there'll be a link, but if you want to go to it directly, it's at nctcog.org/map your experience. This is our timeline. We're currently wrapping up the public outreach phase. We'll move into data analysis and mapping. Basically, we'll take all of the information that we gather from these meetings as well as our survey and pull that all together, compile it, and develop some strategies and draft chapters. Finally, once that's all completed, it will be sent out for public comment. So the public will have an opportunity to see everything and provide some feedback again on that. Perhaps something needs further clarification, or you feel that we need to elaborate on something in particular. This would be a good time to do that. With the final release phase, or the release of the update would be the final phase. This is the contact information for the transportation planners that are currently working on the Access North Texas plan. My name is Dora Kelly, so you can reach me at dkelly@nctcog.org or any one of my peers, Vivian Fung, Gypsy Gavia, and Rachel Jenkins. We can all provide some assistance, whether you have any questions or you'd like a presentation done for your particular group or your peers or your organization. You'll simply just, again, drop us an email and we'll reach out to you and get that ball rolling. Thank you all for joining us. and we hope to see your surveys.